The reason why you want to do this is so you know which side is safe to use. Let's say you're performing oral sex. You decided to put this down, and then you want to do oral sex again. You want to know which side actually touched the genitals the first time around. I'll choose a letter like B, so you'll know which side was touching your lips, and you'll know that the other side was touching the vaginal opening or anus.
Tiffany, so this one has A written on it. So does that mean it's labeled incorrectly?
So A is a symmetrical letter. C from either side of the genitals. So it's going to be really hard for you to tell which side is safe, which is why I recommend using letters like B, that it's really obvious which side is correct.
So letters like A, O, and W, not going to do the job.
And you can also write the entire word on the bottom. That makes it easier.
I love you.
Dental dam from condom. Open your condom. So what you want to do is you roll out the condom, okay? And all you have to do is cut off the tip. Cut it all the way down.
You could also make dental dams out of latex glove.
So take your latex glove. What you want to do is you want to fun fact, you can actually use the finger as finger cots, which is also a way of sex. After you've cut off all the fingers, you take your scissors and at the opening of the glove, simply cut it. So you want to basically make a flat piece. And there you go. You have a dental dam made out of it.
If you have any more questions about dental dams or any other sex health related issues, please ask away. So we'll talk to you later. Bye!
Alright, so did everybody know all the tips that were in there? Did you know you could make dental dams out of gloves, out of condoms? With condoms, you want to use an unlubricated one, or if you're in a pinch, at least kind of like rub off the lubrication because it can have kind of a nasty taste. With gloves, some of them come with powder in them, so gloves are kind of the least expensive barrier that you could be using. So powder-free, the nitrile gloves are latex-free. There are different ways you can cut them. You can cut the gloves in a way so you leave a couple of the fingers and then you kind of have like sort of handles. There's a way that you can cut them and you cut off all the fingers except for the thumb, and then you cut along this side, and then it kind of creates either like a finger hole or a tongue hole. So there are lots of fun ways, not a hole, it's a barrier for the tongue, I should clarify. So there are lots of fun ways you can do it, so you can look around online if that's interesting to you. Adding lube, like they said, can help make it more pleasurable. Okay, so in talking to your partner about safer sex, so ideally talking about these things in sort of the heat of the moment is never ideal because you never have the conversation that you want to. So if, especially when you're comfortable with a person and you've known them for a while, even if not, even if it's sort of something that's happening spontaneously at a bar, try and find a way to discuss it before you do it. Setting the tone for open and honest communication makes a big difference. It's so hard to talk about these things, and sort of doing it in your own way, in an open and honest way, can really sort of help start the conversation that way. So here are a couple conversation starters to get things rolling if you're not quite sure how to bring it up. I can't enjoy sex if I don't feel protected, so I like to use and insert whatever your method of choice is. At my physical, my doctor recommended yearly STI testing, and I got tested. Have you been tested? So again, in relationships where this is safe and this is a choice, These are some ways to bring it up, sort of in terms of setting boundaries. Somebody that you've just met, you can say, tonight I don't want to go farther than this. Tonight I feel comfortable doing this. And that's sort of a way to signal to your partner sort of where you're coming from and what your sort of vision is of things happening. Bringing your protection with you. If you're not going to have sex at your house or wherever you live, sort of making a plan ahead of time. And you can make it sort of sexy. You can hand somebody a condom or a dental dam with your number on it, or say, my place or yours, we're using this. Different options for everybody, but sort of planning it ahead of time and thinking, what works for you, what you think you can say. So talking about pleasure with partners, again, when we talk about sex, we talk a lot about sort of STIs and risk, and it's also important to talk about the fun parts. And again, a key to doing that is sort of making it a regular part of conversation, bringing it up. And in sort of non-sexual situations when you feel like you can really have that conversation. So making I statements, that's sort of a general conflict resolution, a sort of healthy relationships tip. So if you're not really quite sure how to bring it up, you can sort of do it directly or indirectly. You might say, I read this article about oral sex and it said that a lot of women like to do such and such. What do you think about that? Or if you're more comfortable being more direct, and that's something you can do in that relationship, you can say, I like it rough. But we say, be detailed and specific, because for different people that means different things. For some people that might mean hair pulling or something, and for other people that might mean something else, like bondage or things like that. So being detailed and specific and enthusiastic consent. In talking about sex, we're sort of aiming for enthusiastic consent where neither partner is exercising power over another one or coaxing another one. And saying no means no isn't really where the conversation is anymore. It's yes means yes, and it means more than yes. So not just nodding your head, but saying, I like this, and touch me here. And trying to get that from your partners. Let's see. So, in exploring further resources, there's so much to talk about sex, and unfortunately my time is short, so I can't go into everything I'd like to. But I'll direct you to a couple other things. The Human Sex Map is in your resource packet. It's hard to read, I'm sorry, it's very small, but you can see it at humansexmap.com. And it's a very broad view of human sexuality and different interests and sort of areas of things to try. You can pin things you like, pin things you don't like. It can be a conversation starter. It can be a tool for communication with partners. Good Vibrations is a sex-positive store in Coolidge Corner. And they have safe sex stuff, vibrators, sex toys, and a really knowledgeable and sort of comfortable staff that was comfortable fielding all sorts of questions and talking to you about anything. So you can go online, you can read a lot of information, they have a lot of good fact sheets, or you can go to the store. So navigating LGBTQ identities in healthcare. There was some feedback last year. We wanted some more information about how we come out to our providers and why that's important and sort of how to do that. So first of all, we sort of need to talk about what we need to know about LGBTQ health and sort of how our sexual orientations and our gender identities factor into healthcare. So for an activity, I need 20 volunteers from the audience. You don't actually have to say anything. I'm just going to give you cards and you'll step forward. It's a demonstration. So if we could do 10 people in this aisle and 10 people in this aisle. And then I'm going to pass cards out to you. Thank you, volunteers. You don't have to take a quiz. No quizzes. You don't even have to talk. 10 and 10 on each aisle. Thank you. Won't work unless we have 10 in each row.
So is everybody volunteering okay with being videotaped? Yes? It's going to be on... It's going to be on the web. I haven't caught anybody on camera
Thank you
yet.
for bringing that up. So if you feel comfortable being on camera,
Otherwise I won't point it at you. Just let me know. Let me
You don't
know.
have to talk. You don't have to do anything. I'm just going to ask you to step forward. So we have 1, 2, 3, 4, 5, 6, 7, 8. Come on. Come on. We need 1, 2, 3, 4, 5, 6, 7, 8, 9. We need one more for this aisle.
Oh, you do. I have one more.
Is that 10?
Something on it, right?
Some are blank and they'll just be blank. Okay. So what we'll do here is, so this group represents heterosexual people. This group represents lesbians. And we will do a demonstration of sort of the health disparities in the United States. And acknowledging that most of this data is for lesbians, but the disparities are even more severe in our trans communities, and they sort of extend among many different identities, but for these purposes we're demonstrating heterosexual versus lesbian. So if your card says you are a smoker, please step into the middle here where I am.
What? The card says you're a smoker.
Yeah, it's okay, double check.
Is there one more? Are we missing somebody?
Yeah, so you actually have so this is actually probably an error on my part, but so we count 4 lesbians here for, there should be 2 heterosexual people. So we'll go over these, I have graphs to show you, but so LGBT identified people, lesbians are more likely to smoke than heterosexual people, and that's for a variety of different reasons that we can talk about. So it's true for lesbians, but it's true for all people in the LGBT community. So thank you. So go back on the aisles. And if this next one doesn't come out quite right, it means the cards got shuffled, and I'll just go through that. So if your card says that at some point in your life you have had a problem with drinking, please step forward. So I apologize, somewhere along the way cards got shuffled, but this is representative of the fact that lesbians are more likely to identify as having had a problem with drinking at some point in their lives than heterosexual people. You know, one of the reasons for that, there are many, these are sort of, I'm sorry?
Oh, it's
Yeah, it is very serious, I know, and I don't mean to make a joke out of it. It's a fun activity to get people moving, but these are sort of very serious issues that are affecting our community, and sort of part of why we're here to talk about them today is to raise awareness among our women and sort of how to self-advocate. So I'm going to have you all sit back down because we're actually short on time, and it might be more accurate if I just show you the graphs. But thank you very much. Yeah.
recycling this one.
It doesn't matter. They're so mixed up, but thank you. Yeah. All right. Do it. So these data are taken from different sources. So some of LGBTQ people small versus 10% of heterosexual people. So that's for a lot of different reasons. Tobacco companies target our community. We experience more stress, more discrimination, all things that can lead to smoking. Problems with drinking, it's sort of a similar disparity. A lot of our sort of cultural events and gatherings are focused at bars, where obviously you're there to drink, and sort of stigma and discrimination in other public and community spaces where we might not feel safe to go, sort of all plays into that. So psychological distress, this was a survey asking whether people have experienced psychological distress in the past year. So in our community, it was 20% of people who answered affirmatively versus 9% among heterosexual people. So psychological distress, we know depression, anxiety, several different conditions are much more prevalent among our community. So reported suicide attempts among youth. And I'd also like to note among trans youth, this is even more of a great disparity, but here it's showing us 35% have reported an attempt of suicide and versus 10%. So why are we talking about this? We're talking about it to sort of have a backdrop of what health looks like in our community and how we translate that into a healthcare setting. And talking to our healthcare providers, because a healthcare provider who is informed about our sexual orientation, our behaviors, and our relationship can better screen us and sort of offer us services that are relevant to our needs. I mentioned earlier on mammography, 62% of heterosexual women received one in the last 2 years compared to 57% of lesbians and bisexuals. So that's another disparity, and we actually know that among lesbian and bisexual women, they have certain risk factors, more so than heterosexual women, but they're getting screened less. So again, this is like a topic for a whole other workshop, but for sort of the framework and the backdrop of talking about coming out. LGBT health disparities don't exist because of our sexual orientation, because of our gender identity. They exist because of the discrimination that members of our community experience in life that goes on to affect our health. So social stigma and discrimination that can contribute to sort of negative mental health outcomes, more risk-taking in life. Fear or actual discrimination in healthcare settings, so LGBT people are less likely to receive primary health care because they might not feel safe in healthcare settings. So I'm sorry, but I want to get to the questions, so if you could make a quick round if anybody has any questions on the index cards, and I'm going to go through this pretty quickly. So how do you know if your provider is LGBT friendly? Coming out to a provider is a matter of feeling safe and feeling trust. And unfortunately, we don't always have the privilege of being able to sort of pick one based on how LGBT friendly they are. But in the event that we sort of can screen people and try and figure it out, here are some clues. Before you visit, you can look on their policies, look for non-discrimination policies that have to do with gender identity or sexual orientation. Figure out and call and ask if many providers have a clinical interest in LGBT health. You can ask around, where do your friends go? Did they have a good experience? Did they have a bad experience? Look in the waiting rooms. Do you see the Rainbow Times? Do you see Edge? Do you see Bay Windows? Are you looking at the brochures and do you see people who look like you? Do you see communities who, issues that are relevant to our community in the brochures? Are you asked about sexual orientation or gender identity on registration forms? It's another really key part to, one, providing good care for your patients, and two, for having this data and understanding the disparities in better detail than we understand them now, so we can know how better to address them. So other clues. the way that the provider is asking these questions. Do they ask you your sexual orientation? Are they assuming it? Do they use inclusive language like partners? When you have sex, do you have sex with men, women, or both? Are they assuming because you said you were straight? Are they assuming that you've only ever had sex with men? Looking at how they're answering, how they're asking these questions and what they're doing with that information, it's all good clues. If you feel comfortable coming out to your provider, if you sort of have enough sort of hints that it's safe and it's okay, bring it up when you're comfortable. Some people like to do it, grab the doctor a couple minutes before they get changed and undressed, or bring it up in conversation when it feels natural to you. Again, talking about the communication style that works best for you, directly or indirectly. Some people are comfortable saying, I'm a lesbian and I don't have sex with men. Or, you know, when they ask about birth control, that doesn't apply to me. When I have sex with men, I use condoms. When I have sex with women, I use latex barriers. That's very direct, and if you're comfortable doing that, you're welcome to. If you're not, maybe something more indirect, mentioning your partner. Most providers will pick up on this. But if you do choose something that's more indirect, you know, they might ask you a direct question as follow-up. So for more information about how to come out, what to say, comeoutforhealth.org has great information. The Machner Project is they have a lot of patient education information for LGBT women, and they have a guide for coming out. And then there's a helpline that is a peer listening line, so you can call and ask for advice about coming out, either to friends and family, at work, or in healthcare settings. And then the National LGBT Health Education Center is coming out with a brochure on this topic. It's not out yet, but it will be soon. So thank you for listening. Thank you for participating. I have a few minutes. Is anyone keeping time? No one's here, so I'll take a few minutes to answer questions.
How many minutes do you want?
I'm sorry?
How many minutes do you want?
Like just 5?
Okay.
Okay, thanks. So just let me read these real quick, and if there are similar ones. Okay, so there are a couple questions about HPV, which I'll address. Is there a vaccine or something coming out to prevent HPV in people over 26? So not that I know of. The reason the age cutoff is 26 is because that's where it was tested in clinical trials up to age 26, and that's where insurance is covered up to. It's a pretty expensive vaccine if your insurance doesn't cover it. So right now, no, I don't know if there's anything in development. Regular Pap test screenings, those can catch any changes caused by HPV early. Once you're 30 and over, they do those tests usually with something called HPV co-testing. So they're checking to see if you test positive for HPV, in which case they would probably change the regularity with which you're screened, so you would come in more often so they could detect those changes better. And then the other question was, in the case of these skin-to-skin STIs like HPV and herpes, how do you protect yourself when all it takes is skin-to-skin? So that's a great question. And the answer is that there's always risk, no matter what sexual activity you're doing, because of the way that these are transmitted. But using barriers is the best that we have right now. So dental dams for any kind of oral sex, using gloves or condoms on penises or vibrators or sex toys or prosthetics. Anything that's being inserted and changing those condoms between partners and between body parts, that's the best that we can do. But there is still a risk. So, let's see. So STI and STD testing, what tests are routine and what has to be specifically asked for? So this is a great question, and thank you for asking it, because this is another example. Okay, great, thank you. So we have 5 minutes of where providing honest information about our partners and our sexual behavior gets us better health care. If I don't feel comfortable disclosing all the information about my sexual behaviors, I might not get tested for what I need. So it's sort of, you would, depending on your conversation, either with an STD counselor or your provider, based on your sexual behaviors, you would get screened for whatever is appropriate. So herpes, even though it's really common among our community, it's hard to test for unless there's an outbreak. So HPV you also can't really test for. Trick might be something, trichomoniasis. If you come out to your provider, that might be something that they offer to you because it is more prevalent in our community. Gonorrhea and chlamydia testing are sort of like very routine and kind of regardless of what you say, they'll test you for that because they are really, really common. Let's see. Have you seen any disparities among LGBTQ communities of color versus white LGBT communities in terms of STIs? So that's a great question, and I can't really answer it completely because I'm not sure about really the numbers on it. My comment on it would be that we know people experience disparities in different ways and in more than one way. So people, for example, a Spanish-speaking transgender woman might experience discrimination on the level of gender, on the level of ethnicity, regardless of her sexual orientation, and on the level of language. So people who are facing multiple discriminations based on race or ethnicity and sexual orientation are probably more likely to experience some of the things that we talk about, and being less likely to access healthcare, being less likely to feel comfortable talking about it in a healthcare setting. We pointed out to how intimate partner violence affects our community very disproportionately, and those are all factors that can increase risk for STIs. So yes, there probably is more discrimination, and we do know that, and I personally can't kind of rattle off the numbers on it, but it is certainly true. So, any other questions? Oh, there's just one more. So I'm not totally sure if this is from a patient perspective or a provider perspective. What preliminary questions would you have if you came out as trans? So the disclaimer here is that I'm not a clinician and I'm not a medical provider, so I'm not trained in exactly what a medical provider would say to you. And I think that's where this question is coming from, wanting to know what a medical provider would ask. Yeah?
5 minutes.
Okay, 5 minutes. So the short answer to that question is I think the provider would sort of want to know where you are in terms of your gender identity and what that's looking in the sort of greater context of your life and the support that you have, and kind of go from there, connecting you to other resources or providing you information if you're interested in hormonal transition, things like that. That's the sort of the best short answer I can offer. So thank you, everybody. Thank you for participating actively. You had great questions.